link or something? Please give me that.
Okay.
Okay. Content of the meeting.
Sorry.
Sent to a third party.
I can change anything else if you want.
Meanwhile, rest of you, please take a look at the program flow and talk as per the flow. There are questions assigned to each of you. Okay, video unavailable.
All right. Good. I'm on. Good.
Can you send me that link one?
No, it says video unavailable. Okay. All right, got it now. I'll put it in the chat. Okay.
Okay, let's try getting that background one more time. So if you click on chat at the bottom of the screen, Doctor.
All right.
Okay. On the right-hand side of the screen, you'll see a section. Banyaka just put a link in there. Did you see that show up? The link? The YouTube link?
Studio effects mirrored by video or?
No, click on chat.
I did.
Okay, then all the way on the right, you'll see
Meet.
no, it's like a chat box. So people are typing messages and you can see those
meet
messages.
Group chat, right? Meeting group
Yes.
chat?
Yes.
Okay.
And so you'll see someone just put an image in there. Do you see that?
Yes,
the virtual background?
On
the top right corner of it, there's an arrow that's pointing down. Click on that. That downloads the photo.
This one?
It's a small arrow.
Just in the top right corner of the photo. Okay. So just save it anywhere that you'll remember, desktop, whatever.
I'm sorry, guys.
It's okay. Once you click on the download button, it'll open up a dialog box, right? That says save as in the top left.
Wait. Sorry.
Okay. Okay. What? If you also just click on the photo, it'll open up. If you just click on the photo plane, it'll open up in a new window. The background. If you click, can you click on it, please?
I'm trying.
Yep. It's probably open then. It might open in like another window, so it might be behind your Zoom if you made that.
Yes, I can see. That's why I don't know how to do it. I see it there, but I can't.
Oh, you saved it. Okay, then.
No, I don't know. No, I see it somewhere, but I can't.
Okay. Then down at the bottom.
I'm covering the screen right now.
Okay, or else we can do one thing. Sharat Garu, can you make Dr. Mehra a co-host and he'll share the screen? We can guide him that way.
Yeah.
I don't want to hold the program for only the 6 minutes.
Yeah.
No, on the screen, Sharat, there is something else. The content of the meeting is being sent to third party. Got it. It's blocking everybody's view.
Yeah, exactly.
You can click OK on that.
Actually, somebody shared the screen.
Share.
I gave the YouTube link in the chat, Sharat Garu.
No. I mean, no, someone shared the screen.
Because you can't see Cordela's image at all. Half of it is invisible. I mean, it's covered. Because there is something on top of his screen.
No, someone shared the screen.
Who shared
this?
I think I can see Ravinder Garu on the screen.
Someone shared the screen.
Yeah, I can see him.
Hold on. Give me 1 minute. Let me see if I can record this.
All right, if it's okay if Dr. Mehra don't have the image also, that's fine. We don't have to worry about it.
Yeah, that's fine. Yeah, I think we should.
That's absolutely okay. Nobody shared the screen, Sharat Garu. You have put Ravinder Kodela Garu on spotlight. I shared the link with you, the YouTube link.
Okay. Got it.
But do we have to share this latest link to the community?
Right. Give me a second. I mean, not this one. It will be the same link only, one. The previous
Okay.
link only. We'll be streaming to that one only.
Okay.
I'll give a heads up to Ravinder Garu. You know, now Lalish is going to play something, play the bang and everything. Give me 1 second. I apologize.
Someone is talking. Someone is talking. Vasanta Garu, could you please go on mute?
Lalish, నేను యూట్యూబ్ లింక్ ఇచ్చాను. నేను యూట్యూబ్ లింక్ ఇచ్చాను. ఇప్పుడు ఆ యూట్యూబ్ లింక్ తోటి నేను ఫస్ట్ ఏమంటే రవీందర్ గారిని ఒక్కసారి నువ్వు రవీందర్ గారికి కాల్ చేస్తావా? నేను నంబర్ పంపించా కదా ఆయన, అంటే నువ్వు ఆ బ్యాంగ్ ఆ ఇమేజ్ ప్లే చేసిన తర్వాత ఆయన స్టార్ట్ చేయాలి కదా, ఆయనకు ఒక హెడ్సప్ ఇస్తావా? ఒక్కసారి ఆయన కాల్ చేస్తావా ఇప్పుడు? ఆ, ఆ. నేను స్పాట్ లైట్ లో పెట్టాను. ఆ, ఆయనకి అంటే ఇప్పుడు ఇవన్నీ ఈ విమిక్స్ లో అవన్నీ ప్లే చేసేసి ఓకేనా ప్లీజ్? థ్యాంక్ యూ. నేను 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 ప్లే చేస్తున్నాను. బ్యాంగ్ అవి నేను ప్లే చేయలేను.
Nish? Why not? Battery कम हो रही charge.
Just couple of more minutes. I'm sorry about.
Can you hear me? I'm just not sure.
No, we can hear you, Sunil.
Okay, thanks.
Can everyone else switch on their videos? Vasanta and Harika.
So I'm posting a new time in the community because we are running late. It's already 11:10. So I'm just sending a message saying time change to 11:15. Would that work?
Yes, please.
Okay. Or should I put it as 11:20?
No, 11:15 will be good. రవీందర్ గారు మీకు లాలేష్ ఇప్పుడు కాల్ చేస్తున్నాడు. సార్ మీరు అన్మ్యూట్ చేసుకోండి రవీందర్ గారు.
Yeah, I got the message, Sharath. He said to wait for them.
Oh boy, Sunil, you're occupying the whole screen.
I don't know. On the line. I'm sorry, I'm not that
No, that's okay. You're better than me. You're better than me.
I couldn't put that.
Doctors, you don't have to feel bad about it. We know nothing when compared to what
These
sort
guys
of
are good.
knowledge you have. So
I think
please.
they know more. They should have
No,
fixed it.
no. We don't know. We don't know.
Thanks.
So please don't feel bad about it. It's absolutely okay.
Thanks.
You're absolutely fine. That is a very small thing. Once you know, you will be like, oh, this is nothing. So
No.
don't worry about it.
Really didn't pay your cable bill. That's the problem.
I never do that.
I just want to say a quick hi to
Join-
Dr. Mehra and the
join
entire
the club.
NYTTA team. Hi, Dr. Mehra. I'm
Hello,
Ragini.
Hi.
Hi.
how are you?
I was just waiting to say hi to you and everyone because I know that I know that this thing is happening. So I was just waiting for the right
Oh,
time. So
thank
wish you
you.
guys all the best. Yes. And I'll be in touch with you separately later on. And
Oh.
wish you all a fantastic show because I'm gonna watch it in YouTube now. So
Oh, okay.
all right. Yes.
Thanks.
You all take care. Okay. Bye. Bye everybody.
Thank you. Bye-bye. Take
Bye-bye.
care.
Bye.
Me too. Hello, everybody. Good morning. Everybody looking good. Dr. Mehra, really
Thank you.
appreciate you coming on. And I am still watching. I'll be here.
Thank you.
And I want to listen to all of you. Good luck. Take care.
Yes.
Bye-bye.
Oh,
Thank
one
you.
quick thing for Vani. Vani, excellent job doing all these things from last month. This is really a great initiative from NYTTA and the entire team to
Thank
let
you.
us hour with so many things. And I know that a lot of things are upcoming. Great job, Team NYTTA, and really rock on. Okay.
All teamwork,
Alrighty,
Ragini.
guys.
Teamwork.
Yep.
I really like your friendly team. It's really wonderful to have so much cooperation and support.
Yeah.
Why don't you become an honorary member, Sunil? I'll invite you.
No, it's wonderful, guys. You could try to fix my background. I had to put a new picture today, So next time I'll put the NYTTA sign on.
So otherwise, somebody has to take the control of your computer to fix that. That's fine.
Yes. Okay.
Okay, are we going live in a minute, Sharad Garu, or do you want me to change the time to 11:20 or 11:30? Let me
I
know.
think you better change it to 11:30.
No,
Should
that's
I?
good, man.
Ask
Then we can
Sharath,
change
are you
it.
there?
Yeah, I'm there.
That's better one. Maybe due to some technical, we can say.
Exactly.
You
Okay,
think
I'm
more people
changing
will
it to
join?
11:30. Dr. Mehra, is that okay for you? Sorry, because of this.
No. I'm here now. Our other meeting is cancelled at 1 o'clock, so it's no problem.
Okay.
Then if we have 5 minutes, somebody can take control and change it, the background if you want.
See.
Give me a second. I'm trying to expedite this as soon as possible.
Dr. Mehra, can you share your screen? Do you see the share screen button?
Share screen, yes, save.
Are you
I
able to
don't
share?
think
It says host disabled participant screen sharing.
Okay. Let me give you the
Yeah,
access.
please make Dr. Mehra co-host.
I don't think you'll be able to see his controls
No.
when you
Oh, no?
see Zoom controls. Zoom
Oh,
launch control.
yeah.
You can't see the Zoom controls from Zoom control.
Right.
You have to use another software to share the screen.
Oh, okay. Yeah, that's.
మన టీవీ హుకప్ వర్క్ చేయట్లేదా శరత్?
అండి
మన టీవీ హుకప్ అది వర్క్ చేయట్లేదా?
అక్కడ అది లాలేష్ కి ఇంటర్నెట్ పోయిందండి సార్.
Good morning.
Okay, I think share also will not work. Yeah.
గ్రాఫిక్స్ మొత్తం తనే షేర్ చేయాలి లైవ్ లో.
బ్యాంక్ తో సహా కదా?
బ్యాంక్ తో సహా. సో అది
బ్యాంక్ మనం పే చేద్దాం.
లాలేష్ చెప్పలేదు.
Can we share our YouTube link then?
Good morning, everyone.
Good morning, sir. Dr. Mehra,
Okay.
I'll do a video call on your WhatsApp quickly.
Okay, sure.
అయ్యో.
Hello.
Yeah, do you see this document? The stop video, do you see that?
Could you mute your Zoom, Dr. Mehra?
Yes, I see that. Yes.
Mute your Zoom.
So, I see that.
Dr. Mehra, can you mute your Zoom for a second?
ఓకే, ఏదైనా చెయ్యి లాలేష్.
Okay, I open the select camera integrated webcam or choose virtual background.
Sharadgar, can you mute Dr. Mehra for a second? On Zoom?
I can.
Okay.
మరి దానికన్నా ముందంతా ప్రీవియస్ ఫుటేజ్ అంతా ఉంటుంది కదా. అవును. రెడీ అని చెప్పి స్టార్ట్.
Hema, can you please resend the image one more time?
Yes. Okay, so
Kindly bear with me. We are sorting it out. అది ఇచ్చారా ఆయన ఓటీపీ? అది రంగానే అది రంగానే అంటారు. ఇప్పుడే ఇప్పుడు ఏమొస్తుంది? ఇప్పుడు అందరిది వస్తుందా, రవీందర్ గారు ఒక్కరిది వస్తుంది?
I'm on spotlight.
కాసేపు అందరిది పెట్టేసేయండి, పర్లేదు. జస్ట్ యాడ్ ఇట్.
Sure.
అది ఫిక్స్ కాకపోతే మన దానిలో వెళ్ళిపోదాం శరత్.
లే వచ్చేస్తుంది.
లెట్స్ గో ఫ్రమ్ NYTTA. ఓకే.
వెళ్ళిపోదాం అండి. ఒకవేళ అలా కాకపోతే వెళ్ళిపోదాం. అలా వద్దు, నేను చేస్తాను అంటే.
ప్రోగ్రామ్ డిలే అయిపోతే వి లూజ్.
ఆయన
11:30 వరకు కాకపోతే మన దాంట్లో పెట్టేసేయండి శరత్ గారు, గూడూరు గారు.
యా షూర్ అండి.
యా
11:30 is also late కానీ
లేట్, బట్ వాట్ వి కెన్ డూ, 7 minutes కదా ఇంకా. సో
అవునవును, కరెక్ట్. అతను ప్రాబ్లమ్ సాల్వ్ చేస్తున్నాడు. ఇప్పుడు కాకపోతే 11:30కి వెళ్ళిపోదాం.
ఎందుకంటే మనం 2-3 times అట్లా ఇంకా లేట్ అని పెట్టినాం అనుకో, బాగుండదు కదా కమ్యూనిటీలో కూడా.
అవునవును.
So look at Dr. Mehra now.
Yep, he's back in business, looking good.
Oh, Mehra, you're a honorary NYTTA member now.
Yay.
You can't avoid us now.
Woohoo!
గుడ్ థింకింగ్ వాణి.
You're on mute, Mehra.
Admin can unmute him.
Got it?
Yeah.
Okay.
Yeah, Lales, resolved.
Good. We're on now. Good.
Okay, lift change. Okay, ready. రవీందర్ గారు, ప్లీజ్ లాలేష్ కాల్ తీసుకోండి. మీకు హెడ్సప్ ఇస్తాడు, మీరు స్టార్ట్ చేసేసేయండి.
Yeah.
Vani, you can ask people to start watching it.
Okay.
Now we are live on Mana TV. రవీందర్ గారు, మీరు మీ అది అడ్జస్ట్ చేసుకోండి కొంచెం. యా రవీందర్ గారు, మీరు అన్మ్యూట్ లో మీరు కాల్లో ఉన్నారా? మాట్లాడండి.
Can't hear you, Ravinder. Yeah, now.
The background on the live stream on YouTube shows face yoga. Might be too late to fix now.
I think we are ready. Just
Okay.
Andarki namaskaram. Good morning to all NYTTA Telangana Telugu Association viewers across the United States, outside the US, and wherever you are watching this program. My name is Ravinder Kodala, Secretary, NYTTA 2024 team. Today is a bright sunny day outside. I think is a wonderful day. NYTTA is going to team, board of directors, advisors, and executive team bring to you a wonderful second online session on cancer awareness program. We are busy with the day-to-day life and experiencing someone from your family or outside of the family and extended family saying that somebody is suffering from cancer. So what is the cancer? What is its progression? And what is the treatment? What is the prevention? All these programs. Today we have a special guest, Dr.Sunil Mehra is with us to speak about his insights and his experience to the community. Dr. Sunil Mehra is a professor from the Mount Sinai School of Medicine, and he is going to express his insights on especially different type of cancers like lung cancer, adenocarcinoma, like breast cancer, pancreatic, cervical, so and so, etc., etc. There are several cancers you can see, but these are the major cancers. The cancer progression within the people we can hear. So with that, I would like to welcome our president, NYTTA President Vani Singirikonda garu, to start this program.
Thank you, Ravinder Garu. A very good morning, good afternoon, good evening, good night, wherever you are watching from. Namaste. Due to the rise and upsurge of various types of cancers in the world, NYTTA has decided to spread special awareness of this deadly disease. Firstly, I would like to sincerely thank Dr. Krishna Bade Garu, who introduced our guest speaker, Dr. Sunil Mehra Garu, to NYTTA. Dr. Krishna Bade Garu is a famous pulmonologist in New York. He's as well a philanthropist. On that note, I would like to acknowledge the fact that Dr. Bade does not hesitate to render medical help to anyone at any point of time in the day, or as a matter of fact, even midnight. I now request Dr. Bade Garu to speak few words and introduce our guest speaker, Dr. Sunil Mehra Garu.
Good morning. My name is Dr. Krishna Badi, a good friend of Dr. Mehra, back from St. John's Catholic Medical Center days. I know him for the last 30 years. Dr. Mehra is board certified in internal medicine, pulmonary medicine, critical medicine, geriatrics medicine. He served as a medical ICU, St. John's Catholic Medical Center, as the director, assistant director, and also he served as a director of ICU in Forest Hills, Wyckoff Heights. He wrote quite a few papers and is well versed with the lung problems. And also he was member of Lions Club of Long Island and AIA, and he was on all the top of this, he was OPI president for a couple of times, and he was awarded almost like 12 times as the best teacher of the medical faculty in St. John's Hospital and also in Forest Hills Hospital. Dr. Mehra, welcome to the NYTTA sessions program, and we hope we see you more often on this stage. Thank you. Have a nice day, and everybody listen to him first, and then when the question answers come in, then you can ask questions one after that. Thank you. We can start.
Good day, everyone. I want to thank NYTTA, Dr. Bade, and my other colleagues, Dr. Jinnah and Pala, and the whole team. I think you guys are a wonderful team, and you're doing a wonderful work. I'll try to be a part of it, make it simplify. If I have Sharad ji to share the slides with the people, I think the slides, Sharad has to think the slide, but what you want to take home message is that, Krishna, can we have the slides? Share the slides to people can see the slides or no?
Sharad, slides, please.
I think the goal for today's talk is that I want people to take home message. I'm going to talk about different cancer, but lung cancer is our field. Me, Krishna, we had dealt with it for last 35 years. It's one of the common and preventable health problem. And we feel that it's estimated at about 238,000 new patients in 2023. And sad part is, out of them, 127,000 people will die. In general, the cancer is number 2 leading cause of death in this country. Can I have next slide? Which shows, next slide, Sharad. So look at this, the magic. The lung cancer is killing more patient with the 3 next common cancers combined, like colorectal killing 52,000, pancreatic 50,000, breast 43,000, and prostate about 34,000. In general, what we are seeing is that 85 to 90% patients have cancer because of smoking. Only 10 to 15% have never smoked, but they might be living in people who are smoker, like a spouse who doesn't, a lady who doesn't smoke, but the husband smokes 2 packs. So this is the thing to remember. In general, in this country, we diagnosed 5,400, almost 2 million cases every year, which means about 5,400 patients every day. And out of them, 1,700 patients die every day. And out of 2 million new cases diagnosed every year, 611,000 die. So their numbers are staggering and really scary. After cardiac disease, heart disease, cancers remain number 2. Next slide. Next slide. And men and female, Sharad, I'll need, yes. So things to remember, that's what I use the word pulse, that 1 in 4 cancer deaths are because of lung cancer. And I mentioned this, it is commoner. The goal is to prevent it. And these are the risk factors for smoking. Right now we're sticking to smoking. Previous slide, please. Go back. Yeah, next slide, Sharad. Yes. So risk factors, smoking and secondhand smoking constitutes about 80 to 85% cases. Then air pollution, especially radon gas in the houses, and people who work with construction or haven't worked in the ship, cargo area or ship naval dockyards, the asbestos. So a person who smokes and has worked with asbestos has 90 times more risk of lung cancer. Other things you to remember is there's certain types of genetics, family history plays a role. So common thing when we see that most of the cases, 55% of the lung cancer are diagnosed in stage 3 or 4. So if we can take this message home for the listeners to NYTTA program today, that anybody you know, if you can convince any one relative, any one friend, any one sibling to quit smoking, you have done your job of attending this lecture today. And because we have tried, and overall the numbers have gone down in last 20, 30 years of smoking, but in word, the numbers have gone up. We have symptoms when by the time patient comes, they can have cough, spitting blood. They can have a sound from the chest called wheezing, feeling very tired, getting chest discomfort, and losing weight. So these are the things you want to remember. So I summarize again. When a person has symptoms, it's already too late. You can do tests like go to Dr. Bade or any of your PCPs and get X-ray done or CAT scan done. Then he will order sputum test, or then you refer for the last 3 parts. Next slide. So these are the risks. Number 1, smoking, asbestos I mentioned, radon I mentioned, air pollution. Just walking behind a yellow cab or Uber or thing in Manhattan is like smoking a few cigarettes a day. Family predisposition is there, whether because they're being exposed to the same environment, exposure to diesel exhaust, and old scars in the lung because of some old pneumonias, tuberculosis, fibrosis, what we call scar carcinoma. Next slide. Sure, next slide. So I think we have tried, thank you. So these are the symptoms I was talking again, I'm stressing it. Persistent cough, recurrent lung infection, that person keeps getting pneumonia in the same lung. And when you look at the hand, they have this very fullness of their nails. They're losing weight. They're getting short of breath. They're losing their voice, hoarseness, and they're coughing up blood. They feel lack of energy or discomfort in the chest or shoulder, neck. These are the symptoms. Sad part remains that most of the time when the patient has symptoms, they are already in advanced stage. So one thing we can do is that we can try theoretically the best impact is quit smoking. Next slide. But if that is, we have tried our best, we cannot. We can make patient use nicotinamide gum, or you can use a drug called Chantix or Vernaculine or bupropion or Wellbutrin. These are certain things you can try, but the goal is a person must have this put in his mind. Average person who's smoking, it's really a bad habit. Worse than sometimes drugs and alcohol, that person is so much tempted that the average person takes about 7 different attempts to stop smoking. Next slide. So thing is, people will continue smoking even though the incidence is low, but lung cancer will continue to kill. So after feeling screening, I think the best thing is a prevention. What can we do? So we can prevent it or screen them better. So, but this is interesting data by NSLT, which is National Lung Screening Trial. They found that lung cancer patients are almost 5.7, but we are doing only, but 15% people are just undergoing screening with the low dose CAT scan. And when they did the trial with low dose CAT scan, they found that 20% decrease in the death because we were diagnosing these cases early. The key is to if first thing, quit smoking so person doesn't get cancer. If person has lung cancer, we as physicians or as a community, we should put an effort that they undergo screening so that, but it is being adoption. Look, over years, because every lady who's listening to this program had gone through this breast cancer screening mammogram between age of 40 to 74. They do a mammogram every 2 years, and almost 75% people have adopted that. Cervical cancer is another one. Cervical with the pap smear every 3 years, and the HPV virus, the vaccine which we are giving to girls age 12 or more. So that is decreasing the incidence because we're screening it more. And colon cancer, I think Channel 4, the lady who was a news anchor, her husband diagnosed. So I think it came, and now almost everybody is going for after age of 50 or sometime between 44 to 49, especially if there's a family history of colon cancer, colonoscopy, or they go for Cologuard or stool guaiac test, FIT test. So, but screening adaptation has been very good. No doubt, lung cancer screening is still very low because this trial came only 2-3 years ago. And they stopped it between when they realized that we can reduce the incidence and diagnose patients much earlier. So it was adaptation is still little low, 15%. Next slide. So this is the thing. This is the guidelines for lung cancer now. I'm quoting the rule of 50, 80, 20, 15. Essentially means a person should be age of 50 to 80 who is still a smoker or has quit smoking in last 15 years. So, and the person has smoked 1 pack per day for 20 years or half pack per day for 40 years or 2 packs per day for 10 years. If the person has smoked 20 pack years, his age of 50 to 18, and he has stopped smoking in 15 years, that up to 15, there's a high incidence of lung cancer even after quitting. So key is best not to start it when you start. And we know that all other diseases like COPD and everything, any age you stop smoking, you are going to have added age to that person, anywhere from 5 years to 15 years. So if they stop smoking 40, instead of living at 78, they will live to 85. They stop smoking at 65, they will live 5 years more to 70. Next slide. So what can we do? The best test, chest X-ray does not pick up small nodules. So that is, we will talk in a later session, but low dose CAT scan is the best test for people between age of 50 to 80 who have been smoking 20 pack years. So low dose CAT scan, you send it every year for that high risk patient and you will pick up some nodules. Most of those nodules, we call it anything between 5 millimeter, 8 millimeter to 30 millimeter as high risk or moderate risk. Less than 8, you can just monitor them. But, and those nodify tests, if you do it in those people, you will find that 62% of those nodules are benign. And if you send them for surgery, 35% of them turn out to be benign. So it is going to pick up nodules, which could be benign or malignant, but there are certain features, etc., which will make you to send these patients for further tests. Like, next slide. Sharon, next slide. Look, this is a CAT scan which picked up a nodule in the right upper lobe, in the lateral. This part where you see an arrow, that's the lung tumor. So next slide. So this is the advantage. The rest of the lungs are clear. Look, the patient comes to me or Dr. Bade, and then we decide if patient is spitting blood. We do a bronchoscopy and you see a big mass in the right side of your screen. And there's a big tumor. It's the lung cancer in the bronchial tubes. Next slide. So if the tumor, and if the, like that CAT scan we showed, the nodule is in the back, you can send them to the radiologist in your hospital, or your doctor will send the patient, which will do a CAT scan guided biopsy of that lesion and make a diagnosis. Then we can send this patient to our oncologist friends or surgeons. Next slide. So these are the pulse to message, what we just tested in last 4 or 5 slides. A person should be age of 50 to 80. He has smoked 20 pack years. He has quit smoking within 15 years of screening. It should be done annually. And patient, like if they have HIV or the disease, they know that their not lifespan is not more than, we can be a little lax. And it is really important that most of these nodules large trial are found, but they're patient, they are mostly benign, as mentioned to your data. 62% those biopsies will be negative. If the patient has removed, 35% will be benign, but I will not take the chance. Any nodule which shows up in the CAT scan, which was not present 2 years ago, and the person has been smoker, that nodule should be coming out. That is stage 1 or 2, because best survival is between stage 1 and 2A. We find if you find a patient in the lung cancer in stage 1, almost 65, 67% will live up to 5 years. If the stage 3 or 4, only average 5-year survival is 18%. So if, because most of the cases are diagnosed in stage 3 and 4, 55% cases are diagnosing in stage 3 or 4. Next slide. So these are some concern because person doesn't is worried. He feels guilt that why should I be doing it? Sometimes insurance gives hard time to do an annual CAT scan. A person feels anxious. So these are the few features that's why it's only 15% screening. Next slide. So these are the lung cancer. The most common lung cancer is 40% is what we call adenocarcinoma. And this is the most common type of cancer. 15% is then 30% is your squamous cell carcinoma, 15% is large cell cancer, and 15% small cell. The most common cancer related to smoking is squamous cell carcinoma, 30%, and small cell carcinoma. But if somebody asks a question, most common kind remains adenocarcinoma, or what we call these terms are combined called non-small cell carcinoma, in which you combine adenocarcinoma, squamous, and small cell. Next. So this is stage 1. A lot of people will live for 5 years. 60 is the time in months. And moment you are in patient in stage 3, 4, survival is 3 to 7%. Different. It's a localized disease or small cell. Small cell is 3%. In non-small cell, 7%. Up in the stage, non-small cell stage 1, 2 is almost 67%. In small cells, it's only 30%. So a person is best thing is to avoid getting cancer by avoiding all those risk factors. If we can't stop smoking, then we must try to diagnose early. So next slide, I'll move on to some other thing. So prognosis, this is what I mentioned, localized disease. This is a SEER stage. The American Cancer Society monitors that, which is surveillance, epidemiology, and end result. Localized disease is present in the same lung, regional in the region, same area, lymph node. Distance is when person has cancer spread to bones, liver, brain, etc. And you see that survival is really sad. 17, 18% in non-small, and in the small cell it's less. So combined is 18% is distant disease. Next slide. So a question comes, what do we do? But as I said, our goal remains prevention, then screening, then early diagnosis. If a patient is diagnosed in stage 1 or stage 2A, best therapy is surgery. And you can use the word cure. As I mentioned, about 67% people will live 5 years. But there's a word cure, because everybody behaves differently depending on their epidemiological factors, genetics, environmental, economical factors, because insurance coverage. And if that is not the case, or patient has advanced disease, then our oncologist friend come in picture. They give a chemotherapy, and then they will decide, is it chemotherapy alone or radiation therapy? And now there's an advancement in last decade, remarkable immune therapy. And then it's checking the antigens and EGFR and other things. And then what we are using, what we call a target therapy. These are advancements which are in the realm of oncologists. As a pulmonary doctor, me, Dr. Bade, etc., we diagnose the case, whether we do CT-guided biopsy, bronchoscopy, and if it's stage 1, stage 2, we send the patient to surgery. If it's a small cell cancer, surgery has no role. It's mostly chemotherapy or immunotherapy in certain cases which have high time, and it has definitely prolonged life in last few years. So these are the 2 advancements you want to remember, immunotherapy and target therapy. Next slide. So these are the things I wanted to go as shifted. So top 3 cancers in men remain lung, bronchus, which we stress a lot of point, number 2, prostate, number 3, colon. And I mentioned the screening is quite well. Top 3 cancers in ladies also remain lung. Lung has, gone beyond breast because of smoking. Between 60s and 70s, if older people, they remember the Virginia Slims ads that you have come a long way, baby. Every young girl who wants to remain, or young adult ladies, who want to say size 1 and want to be 5'6", 5'7". They love those big Virginia Slims ads, and now sadly they are paying the price. So lung cancer has surpassed breast cancer in ladies also. So this is, and that's next, I mentioned to you, next to this graph, 5,480 new cases every day of some kind of cancer. Out of them, 1,700 will die, projected in 2024. 2 million patients every year, and 611,000 will die. So that is important. So the so-called current screening recommendations remain stage A is in these cases at age for your cervical cancer 21 to late age 65. Every 2-3 years you get pap smear and get HPV. In colorectal cancer, between age of 50 to 75% should for colonoscopy. And grade B, these are grade A, B, C are related to studies, and which essentially means 40 to 49 if patient has family history of cancer, early ages, parents had, so you want to do it a little early. Breast cancer is definitely between 40 to 75 every 2-year mammogram, and screening is very well accepted by ladies at 75%. And in the prostate cancer is variable, but definitely between age of 55 to 70. The things are changing in prostate. They used to say PSA. Now they feel if patient is beyond 75, the chances if they get prostate cancer, you don't need to do PSA that often. So these are the few things I wanted to go over it with you. Next slide. And thanks for adding these slides on the short notice. This is the same thing we mentioned, that current screening for all the patients. And these are the lower part, mammogram, what is the sensitivity. So the sensitivity is good. Specificity is less in prostate and other cancer with lung cancer, but overall mammo and stool-based test and all other colorectal screening, they're remarkable. So if a person, very important, if you have certain risk factors, a person is a smoker, a person is, so that just not just the lung, it will do the GI tract, bladder cancer, etc., very common. Certain HIV have certain type of cancer called Kaposi scars. So depending on the risk, family history, a person should go for screening. And other interesting thing, next slide. I just added this slide last and want to thank. This is important. 71% of the cancer deaths are from cancer which are beyond these 4-5 common sites. So there are limitations, but there are no screening tests available for these tests. Next. So these are the things. Cancer mortality by race also changes. Very interestingly, all type of cancers is going to be up, and we feel that in Black male, there are 12% more incidence than white male, than white female, then Black female, 16% less, and mortality goes up and down. So thinking in mind that if we have 71% of the cancers which are different than all the 4-5 I mentioned earlier, cervical, colon, breast, prostate, pancreas. So they are coming up with this, and this is a new test. This is a new advancement. It is not yet FDA approved. It's called multi-cancer early detection. As a remarkable test, you take a 5cc tube and send it. And there are 3 companies which are making it. Carry, the Gallery, and there's the last one we have is called, I think there's a different called Oversee. So these are detect, the best one so far has been Gallery, and that can screen for 50 cancers. So you have to wait for another couple of years. It is going to be approved by FDA. It's an expensive test, but people who are economically well, because no insurance covers this, so they can go. Only disadvantage of this is significant, still the high number of false positive. So it's picking up sometime positive, then the patient doesn't have lung cancer. So that is thing, and they basically do is what we call different auto antiproteins or CES non-cancer predictors in the blood. So overall, in last 30 minutes or so, what I have tried to talk to you mostly about lung cancer, how to prevent it, how to screen it. We talk about cervical cancer, breast cancer, colon cancer, and screening is quite well adapted and accepted by community and public and doctors. And then we have 70% cancer, which are like not the common type, sarcomas, leukemia, this, in which now we can do this called multiple cancer early detection blood test. And I think within the next 2-3 years, it will be approved by FDA. So basically, they're trying to refine it so that false positive numbers are less. I think at this moment, I'll take a break and ask you guys. Next, any slide more left, Sharaji? So this is the same test I just mentioned. Next. I will stop at this stage and I'll be very happy to ask you. Thank you.
Yeah. Thank you, Dr. Mehra, for this wonderful, much needed session on cancer awareness. I'm very sure everyone who is watching the show will take home some golden nuggets. So to start with, I'll start with some questions myself.
Sure.
So in this modern days, you know, the lifestyle is one of the major things that changed when we compare to, you know, our parents or our grandparents to what our lifestyle is today. So, you know, like how can individuals reduce the risk of developing cancer through lifestyle choices?
A very interesting, very important question. One thing in a nutshell, no type of food group can stop or prevent cancer. But as we have seen it over decades and in our culture, Indian culture, a vegetarian-based diet is a very good diet. A person which is what we call rainbow diet, anything colored diet, this is wonderful, but at the same time, less meat, better. Those red meats, don't avoid them. Just linear or like chicken or fish if you want to eat. And avoid processed foods, canned foods, stress. The vegans or vegetarians think that if they can eat processed food, this is no good. Refined sugars, get rid of those sugars. Same white rice. A lot of us, we love our biryanis, right? So we have to enjoy the vegetarian diet is wonderful. But again, as I said, there's no specific group. There are certain things like what we eat, broccoli, cabbage, and all. They're wonderful in vitamin supplements. But if somebody asks me a question as of yesterday, I will say that there's no food group which we say that eat this and that will avoid it. So best thing if you can do is no smoking, no drinking, if possible. If you do, the ladies advise maximum 1 drink and men 2 drinks a day possible. I mean, I'm not promoting drinking because alcohol has a lot of cancers also, GI tract, bladder, etc. So if we can avoid those processed foods, canned foods, so have fresh food, fresh vegetables, avoid those so-called concentrated sweets, because they all are going to make you prone to get obese, and then uterine cancer and all those things add up onto that. So the food type is avoid processed foods, refined sugars, no smoking, drinking to the minimum. So that should answer the question.
Thank you, Dr. Mehra. My next question is, I mean, you already covered in your slides about the screenings of the cancer, but I want you to, could you please like summarize the specific cancer screening based on, you know, like how should we prioritize these cancer screenings based on our age?
So I think especially the female nowadays feel that used to be 40, but ladies, cervical cancer. After age of 21, pap smear every few years. Colon cancer until age 50 to beyond. But if there's a family history or there's a change in any bowel habit, go for colonoscopy early. Some people are reluctant. I am one of them. So they can go for a FIT test or fecal blood test, which is easy, can be given a slide to take home, or now they have a Cologuard test, which picks up the cancer antigen. So 50 or above, one person should go for colon. These are the commonest types. And if the person's family history of colon cancer is early, please go between age of 44 to 49. Breast cancer, same, all ladies above age of 50 must go. But if there's a family history, and then they can do BRCA antigen, BRCA antigen. And if the antigen is positive, I have seen it happening between the siblings, 2 sisters, mom and 2 daughters. So if there's a mom or has it, the kids should be checked for BRCA antigen. And if antigen is positive, they should be more aggressive. I've seen people if they have made their family, have kids, they go for mastectomies, prophylactic mastectomies, even though they are not diagnosed, because or they should go for, this is being very aggressive. And I'm talking in mind, I have 2 doctor friends between the age of 40, 45 who underwent bilateral mastectomy. They already had kids because the parents had it, and you don't want to miss it. Parents had it, Masi or aunt had it. So that family history is very important. It's a lot of genetics play a role. And that's where this M-Street, the test will come in picture. Then we talked about breast and cancer, and the lung, I mentioned 50-80% should go for low dose CAT scan almost every year. And the prostate was a questionable, person should do after age of between that 55 to 70 is the incidence with the high incidence. After that, you don't, it's your discretion of the male patient thing. Breast cancer, I just had a Indian patient who had a breast cancer. So breast cancer is not just a ladies' disease, but mostly again, 90-95% cases are ladies. So these are the things you want to, in the ladies, pap smears, mammogram every few years, colonoscopy, prostate I mentioned, lung cancer I mentioned. These are 5 common. Sad part in young pediatric age group, again, not much experience, but in my family, my grandson had a leukemia at age 2, so we went through very rough time for 5 years. So their genetics do play a role, so you have to keep a watch on these things.
Thank you, Dr. Mehra. Dr. Badigar, do you have any comments? Do you want to add something here? Could you please unmute yourself?
The most important thing, as Mehra said, is stop smoking. It's not only that, at one time, like 15, 20 years ago, they used to say, oh, no, my father smokes, so I don't think I'm going to get a cancer. I had a patient who was only 21 years old, young kid, comes to my office with vague chest discomfort. And I was not comfortable. Get a chest x-ray, guy has got, as I said yesterday, ping pong ball in his chest. That was the tumor sitting in there in the mediastinum, that's the center part of the chest. And then I had to call his father and tell him, then he says, sorry, dog, I know I have cancer. And he was sitting in the living room when I was smoking like a chimney. So then I told him bluntly, sometimes very bluntly, I said, listen, you destroyed your son's life. So you do, either you want me to take him wherever I take them, or you want to take him. And he said, no, doc, I have a physician who takes care of me in Sloan Kettering in New Jersey. I'll take him there. And he took him there, and God, unfortunately, after 3 years, the kid died, only at 24. So it's not only you smoking, but somebody sitting in with you smoking, wife, son, husband, children, grandchildren too. There's a lot of elderly population, they play with the grandchildren and then they smoke. That's not the way it should be. Any simple sign like loss of weight, cough, chronic cough, and then coughing in the blood, these are the more common signs. So you should get to your primary care physician, get things worked on. There are a lot of, as Mehra said, blood tests that are popping up to identify in early stages. That's all I can say.
Thank you, Dr. Badigaru. I'll pass it on to Srinivas Guru Garu for any questions.
Thank you, Vani. Thank you, Dr. Sunil Mehra and Dr. Krishna Bade for this wonderful session, informative session. Awareness is power. And that's what NYTTA is trying to bring to the community, to bring awareness for the health factors. I have a question: how anybody can um, detect cancer at an early stage? What are the regular health checkups or the screenings one should undergo on a, you mentioned by age group, but what do you think the generic screenings one should undergo?
think a certain age, like basically for lung cancer, I already mentioned in all the 5 different ages when you should do it. Before those ages, if you don't have risk factor, you don't need to do anything. I always say number 1 is cardiac disease. Number 2 is this. So I think for those anybody, I always tell my people like 40 or above, because our lifestyle when we were in India were very different. We have changed. We have more stress. We should guide like other than when we talk about diet. So I think 40 or above, once every couple of years, you should have your blood test and cholesterol done. Try to get rid of those high risk things, stressful job, meditation, do some dharma, and do some meditation, reduce stress in your life, eat those vegetarian food. And screening, I already mentioned, CAT scan, when to need it, colonoscopy, screw guai, PSA test, and HPV vaccine, etc. So I think that question was answered, Doctor.
Thank you, Doc. And what are the advancements made in cancer research and treatment recently?
I think like we all have young kids who are going to, I think immunology has played a lot of role. And as I mentioned, these blood tests, this is a very going to find out what cancer of 100 different types of cancer. So this is a thing which is being happening. Then we have a notified test that if you find a nodule in the lung, you do again a blood test which finds certain kind of proteins, which say what we call it notified CDT, cancer detecting test. So these are the things which are making us diagnose early. Then there's certain type of carcinogenic thing, like we do a CEA level, even though all these things, PSA level and CA 120 level for ovary. So blood tests in people looking for ovarian cancer, pancreatic, we do CA 19 by 9. So there are a lot of these tests or in the immune complexes we are looking that can find. In the treatment I mentioned, the immunotherapy has played a remarkable role. These are kind of monoclonal antibodies, which are not just in lung cancer, rheumatoid arthritis, ulcerative colitis, psoriatic arthritis. So they are the injections you're getting. For now, for cholesterol, you're getting this MAB treatment, we call it, monoclonal antibodies. So there are a lot of remarkable, then they're doing the immunotherapy in lung cancer. They're doing targeted therapy related to certain types of cancer, leukemia, certain type, myeloma. So I think, remarkable workup is being done every day. So most of the advances are happening in the oncology field.
Thank you. Thank you for all the research the doctors are doing. Thank you, sir. I'll pass on to the next.
Hello. Hello, Mehra ji.
Hello.
This is a very nice session that you're conducting so for awareness, and thank you, Vani, for bringing in more doctors to provide these kind of awareness sessions. So I know it's cancer is like nowadays it's every person I see like they have a friend or relative who is suffering from cancer. Like it's now very like a common disease that we are seeing nowadays. Unfortunately, even my mother-in-law passed away with cancer, and she was, I mean, like she was a pure vegetarian, like no bad habits, but she unfortunately passed away with lung cancer. So I understand, but I just want to know, like, are there any success stories where there are survivors from cancer, just to inspire some hope?
Oh, definitely. I think one thing we learned from leukemias in kids, that nobody will survive. Now we're 95% survival. I might give you a simple example. My grandson, the day he turned 2, he was diagnosed with acute leukemia. Our family went through very rough time for next 5 years. My daughter almost got very depressed. She was 24, 26 years old. So, but the kid is cured now. He's more than 5 years. We call it survival. If you survive any cancer more than 5 years, you call it as a cancer survivor. Breast cancer, we are seeing so much remarkable thing. A friend who's a doctor, his daughter-in-law was like 29. Breast cancer, it's almost 24 years. So these are the things that if we are diagnosing early, there's a remarkable thing you can cure. So same thing, Hodgkin lymphoma, stage 1, stage 2, stage 3, you can use the word cure. So I think refinement, we are all, I used to dread it and was very reluctant to send. I learned one thing. Sooner you diagnose, immediately you start treatment. Don't worry about side effect. It's better to live longer and with your family, spend time. So I'm sorry about your mother-in-law, but I think there's one in, I think, 4th or 7th family has cancer in the family. So as we have improved the lifespan of human being, average male is living about 78, women 83. So we have increased the incidence of person has to die somewhere, because when we came to this world anywhere, God had decided you're going to be born on this date. This is our Hindu mythology. But at the same time, yes, stress stories are there with certain kind of cancers. Breast seen pure cures. Colon cancer has seen cures. I have had 3-4 colleagues who had like stage 2 or 3 colon cancer. They are beyond almost 14-15 years. So key is, if first good thing, if you have doubt, go get it tested. Get tested, get immediate treatment. Don't listen to people, go for this Ayurveda, this therapy. They do help certain ways. I have nothing against them. But if you have best treatment available in a country like USA or especially New York, you have best institutions, go for early treatment, and believe me, you will see the cure, you will see the happiness in the family.
That's good to know that at least in US and especially in New York, we have, very good doctors to help out. And just to check, are there any resources here, especially in US, are there any resources available for emotional or psychological support during these cancer treatments?
This is the wonderful thing, that this is our Indian society is like that. We grew up in like families where chacha, uncle, aunt, we all lived same. So I think the family sport is very, very important. Community sport, what NYTTA is doing, what Indian National Long Island is doing. Here we are not just this from regionalism, Punjab, Gujarat, Tamil, Telugu. No, as a community, we should raise the awareness. We should come as a community, bring groups. Yes, anytime you have anything, you have alcohol anonymous, smoking, myeloma, Alzheimer. Yes, there are centers. You just Google it with the type of cancer, anything, you will find the awareness. So there are a lot of sport available, but as Indian community, I think family sport, friend sport, because in this country we have more friends than we have families. Few of us have no families, just friends. So I think the sport group should be arranged, and this is where NYTTA or other associations should come in picture. The sport, guide them, the people, send the kids who volunteer, send them to the people who have no family or anything. So I think that there is sport available, there are groups available, and we as a community can do more for this.
Thank you.
Mohan Garu, let me tell you my own experience. I had a patient who was 42 years old, walked into me in my office with a cough. I had to get a chest x-ray. Sunil, you won't believe she had only 0.8 millimeters nodule on the right lower lobe. That's very small. And I was not comfortable saying, wait, let's watch and see. I took a CAT scan that was much more positive. I had to send her to Sloan Kettering Memorial with a good friend of mine. His name is Robert Downey Jr., not the cinema actor, but his name is Robert Downey Jr. Gentleman did a whole right lower lobectomy, that means took out the lower part of the lung. And chemotherapy, then radiation. She's still surviving. It's almost like 5.5 years now. Every time she comes to my office, first thing she says, "Oh, Dr. Barry, I'm still alive." I said, I didn't do anything. It's the God's grace, and at least we caught in time. So that's what is more necessary. That's the best thing. Once you have some kind of symptom where you're not comfortable, get to your primary doctor and then let them work it out. And it's easy for the primary doctor, the specialist, and everybody else, rather than
Right.
waiting. దగ్గు వస్తుంది వెయిట్ చేస్తాము తుమ్ము వస్తుంది వెయిట్ చేస్తాము. And some people are like that. I'm spitting blood, it's because of the cough. It's not because of the cough. There is something wrong somewhere. So you have to get to see a physician and get the things ball rolling. Okay.
Thank you, Baligaru.
Thank you.
Yeah, that's it for me.
Rama said she has a question.
Hi, Andy. Good afternoon. And Dr. Mehra garu, this is a
Hello.
very good session because this is the burning issue now, the cancer. There is no age limit. We are saying that after 40, after 50, but recently I heard about 25 years of kids got the cancer. So my question is, what role does nutrition play in preventing or supporting cancer treatment?
As I mentioned when Vaniji asked me this question, that there's no food group which has been shown to protect cancer. Best thing is because we live in a society where like the vegetable, everything is cooked, is processed. They have a lot of sprays of chemicals and everything. So they do play a major role. So best thing to avoid is eat a healthy, nutritious diet, avoid smoking, alcoholic, processed food, concentrated sweets, etc. The white rice, there are certain things you want not to eat. Organic food, again, no doubt whole food is making more money because of that. But certain thing as you can avoid is avoid, if you get fruit or anything at home, just wash them thoroughly before you make them, So I think no food group as a general, but smoking, alcoholic, or processed or constant, those things you should avoid. And eating a vegetable definitely help. Fruit, wonderful. Don't eat like, we love sweets after dinner, but try to change them with the food. So, but if you read the literature, there's no specific food group which has been said that this will prevent cancer.
Thank you.
Thank
And I
you.
have one more question.
Sure.
Can you elaborate on the role of genetic factors in cancer and how genetic testing may contribute to prevent an early intervention?
Very, very, very important. As I mentioned that certain cancer, breast I mentioned, BRCA antigen, BRCA antigen, and certain types in the lung cancer we mentioned this, or then 71, this mixed blood type early detection test. So genetics have an important role, and they're refining and doing the gene studies now. Genomes are being done, and depending upon genome, they're doing the specific targeted therapy. So they have a wonderful role, and that's why they keep looking for certain type of antigen or certain tests so that we can diagnose these people early, especially in people in which there's a genetic history that mom had it, grandpa had it, or somebody else. So these are the genetic studies, or genomes are being done on every type of cancer now at Sloan and at Cornell, etc., big institutions.
Thank you, Dr. Garu. Thank you, Vani and EC team, to bringing such a wonderful session to the NYTTA community, and keep going.
Thank you.
I think Shalini has some questions. She's taking some questions from the community chat. And
Thank you, Vani. Dr. Mehra garu, thank you very much for all the information. I have a couple of questions. One is very personal to you. Your family member had a cancer. What advice would you give to the caregivers or the family members who is supporting the patients or the family members going through these treatments?
I tell you, it's a family sport. I mean, my daughter, my first daughter, we have my 3 daughters, so she lived in Rhode Island. My wife had to spend first 9 months or 1 year there. I will go every 3 weeks. She still got depressed because there was only nobody there. She, her husband, and my wife. Or on weekends, I will went. I think family sport is very important. After like a year, and we had to bring her back to New York, kept in the house for 2.5, 3 years. So, but sadly, sometimes there's nobody. I think this is where the role of friends come, that we each should spend an hour to get food, give money, whatever we can, in whatever respect we can. So that support you need economically, emotionally, very important. That don't worry, you are not alone. We are fighting with you. At the same time, help them, like the kid never left the hospital for first 5.5, 6 months. It was 2 years old. My daughter will sit there and she's a doctor. She's got depressed. She couldn't continue her training. So my mother and my wife, they will just sit there together. I'll go on Friday. We just hold the baby, and I think there's nothing like family or friend support. We are very God-fearing people. I think a little meditation, a little prayer, little blessing. I don't think there was any nurse or any friend who I met in the hospital who says, I went to the church, I lit a candle for your grandson, I'm praying for it. I think all things play a role in it. So again, I'm a strong proponent of God and sport. At the same time, medication should be given, must be given, and at appropriate time. So I think whosoever is listening, provide a bond, we always make fun, or we always have parties together, we enjoy the weddings and everything, but this is one time where your family or friend need much support. Even though you can't do anything, just stay with them, spend time with them. So that I think I learned. I always felt that if there's a fire in a neighborhood, you feel the heat, but when fire happens in your home, then you find what is the fire is. So that is, I think I learned to be more humble and more God-fearing. So.
Thank you so much, Mr. Agar. That's wonderful advice for any family, friends whose a member is going through such treatments. My other question is, I heard a lot about Ayurvedic treatments and homeopathic treatments for cancer. Do you advise for somebody going through those treatments?
Again, as a allopathic doctor, I'm trained here for 7 years. I have 4 different training. Ayurvedic, I think they have a role, but there are no scientific studies. I will not change therapy from allopathic to only Ayurvedic. I said follow the therapy which is available in the best institutions here. If you want to try something on, keep trying. If sometimes it's psychological, sometimes it's families pressure. I will not change it. If they want to do Ayurvedic, do it. Remember that Ayurvedic has a long history in our culture. There are a lot of the medications in allopathic might be coming from Ayurvedic, but there's no scientific data that one drop of those white tablets or a thing will make a difference. So I think being a scientist, I want to go with the scientific studies. I'll stick to allopathic. I will. If you want to continue on the side, say grandma said that take this pudiya and do this, do it. Again, it's for their satisfaction. They feel somebody is listening to them, but I will stick to the therapy here.
Okay. That's good advice. My other question is a question from the community. They're asking how much does it cost after insurance payments for an individual to go through such treatments in a cancer journey?
God, very painful, but most of the insurances will cover you. If they can cover you, there are a lot of support by the drug companies, by the physician you go through. I can simply tell you during that, it was more than $1.2, $1.4 million. 80%, 90% was paid by the insurance, but still, it can
add up.
To get families into bankruptcy. But I see that it's sad part is that oncology drugs are very, very expensive. So I think you should ask for any help available. And the oncologist, normally they have a social worker and everybody in there. So they can help you to get those help. So the help is available, cost is exuberant.
Wow. Okay. That's all I got. Thank you very much, Dr.
Thank
Mehra.
you. And there are ways to go around the thing.
Insurance.
I cannot do it on this. Get the American Express, which is called Medicaid card. You don't work. I have seen parents getting divorced on paper so that the mother say I have no job or anything. People have done a lot of things and nothing is wrong, I will say. When it's a question of life of your family.
Everything is fair.
Everything is fair. This is true.
Let me say one thing. Most of the cancer drugs, they have their own trust funds, especially for the people who can't afford to pay the bills. Social service trust funds and then philanthropic trust funds. The hospital itself has trust funds. So somebody need to knock on the right door to get help. That's all.
They're very helpful. Social service or your oncologist, that they know where to get help and they will get the money for them.
You have to approach the right people. They'll definitely work with you and they will try to get the maximum help so that you won't end up
Anytime
bankrupt.
you need help, you can reach Dr. Bade, Dr. Me. We have a lot of, again, I was president of AAPI, American S. So we have contacts, our own people. Like when I lived in Flushing, Queens, so the local Hindu center, the temple, knew that if anybody's parents are visiting from India who have no insurance, I'll see them free. So there's no problem. We have same thing. Oncologists have very good friends who have never said no to me or to us. So whichever help we can will be providing to our community. And we are all community together. So don't hesitate to get in touch with Dr. Bade, Dr. Jinnah, Dr. Pala, Vaniji, and Shalini, and Sharat, and we all people who are here. And that's why we are together, the executive committee. That's what our role is. This is a volunteer work, and we are doing it for the sake of all of us.
Absolutely. Thank you so much for all your support.
Yeah, thank you.
Dr. Mehra, I have a question, a specific question, especially. So those we come from India, different tropical conditions, and here, experiencing with cold conditions. So I have a specific question regards, of course, the two questions in a single frame. For women, the breast cancer, and for the men is the prostate cancer. So people, how to identify, with your own experience with this, especially women and men, these cancers are very dangerous. So how to detect, how to identify this with your PCP? So these cancers, please advise with a couple of,
If there's a female, as I mentioned, if there's no family history of breast cancer, at age 50, every woman should go for mammogram every 2 years. Every 2 years. Prostate cancer, same thing. A person normally, what we call BPH, benign prostate hypertrophy, they will have symptom of increased urination, nighttime urination. But again, all these cancers don't have, after age of 50, like every time you go for your annual physical, they should do a digital exam done by your physician. And then if he feels any, like prostate is not smooth, is enlarged or nodular, he will send you to a urologist. Between age of 55 to 70, that is the recommendation. Less than 49, 50, no need, unless there's a again of families has a history, then you should go for early examination. So key is to screen before the symptoms come. And a PSA test between age 50 to 75 or 55 to 70, the person, every doctor, when you go to them, they will do your PSA when you're between this age. But if you have symptom of prostatitis, or you say my uncle had this kind of thing, then they will do PSA early, even at 45, because insurance doesn't want to cover it. But once doctor raises a family history, they will have to cover it.
Thank you, doctor.
You're welcome.
All right. I actually have a question now. Hi, Dr. Mehra.
Emma has been very quiet lately. Thank you.
What ways can communities come together to raise awareness for those with cancer, to support those with cancer? I feel like we've spoken a lot about the family and friends space, but I think as a group, we're coming in as a community organization, right? From a cultural organization. If you could speak to some resources that you know of.
I think programs like these,
Yeah.
I think anytime you have a big gala or function, you spend 5 minutes talking about these things. So I think sad part is that we have become regionalism, that's it. So I think we should all come together. In Long Island, you will find about 20 of them. In 1996, I was the president of Indian Association Long Island. We had 25,000 Indians living that time in Long Island. We have more than 120,000. So they have spread. So now we have 20 associations. But I think they should all come together, the resource to come together. Because, we can keep asking money, but we're not spending on the right things. So all associations should have $5,000, $10,000. And every time there's a newspaper, these kind of any program, we should have this awareness and say, we are here available, we are available. So these are the resources. Money, most of us are doing very well. Most of us people, we go to school, we make a decent living after a certain age. So I think we should, certain communities are wonderful. We give a lot of money to temples, but why can't we just, even the temple should have a thing where, come on, if you have $1 million, give 50,000, 20,000, 10,000 for people who cannot afford it. Just provide them a taxi ride to get the chemotherapy. Awareness. You have young people like you, involve more younger people, I think, who are hungry to help. The schools here, I find a remarkable thing in high schools that kids do the volunteer work coming 9th, 10th, 11th grade. So I think we have to bring people together. And I think we'll start with young. Older people are in the photo ceremonies, wherever they want to have a picture with even the MP visiting from India. So I think you young people have to take that task now in your hands. And this is again, this is a human touch, not medical charge, but I mean, I think we are all reaching that phase where we should start doing some community decent work, decent, honest work.
And yeah, thanks, Doctor. Would it be possible also if after this call we connect with you and maybe you could share some resources that we can also share with the community?
Anytime. I will be very happy to be of any help. I think Vaniji has my number and you can give it to all community. Any person needs help for themselves, for the parents visiting who cannot afford a free visit, no problem.
Great, thank you.
Thank you.
I just want to say something. I think Vani knows and everybody in the NYTTA knows. If anybody needs any help, as far as I know, as far as Mehra knows, you can call me anytime and don't worry about the fees. And I'm not a fees monger or anything like that. And if I have any kind of samples, I just give it away. That's what I've been doing with the Mana Health Group, also MK Health Support, and I've done Vani knows, and quite a few people with the NYTTA know. I did whatever I can do during the COVID situation. Even Mehra did a lot of things during the COVID situation. So the only thing is you have to come out and speak. What do you want? What is the problem? In that way, if we can't help you, then we'll try to get somewhere who can do some help. Okay.
Remember that this is the thing that, like in your association, you have 4 doctors. Like when I was part of this, I used to have Rotary Club in Long Island. I'll go to my 10 friends' offices and get medications and everything. So, so from there and give it to the Rotary Club, and they will give it to people there at 6 in Hampstead area. So then I started the food network for last 25 years. We collect food during the Thanksgiving time or Diwali time, and we give it to these food. There's a very nice interfaith nutritional network called IN. It's run by 2 Catholics in Hampstead. They have 6. So we collect food from all these Indian stores and people who can give money. Almost we collect 15, 20. And some of the ladies, like, they go and serve the food also. So these are the thing. And I think young people who need it, this is the best thing. You just go collect it Last 2 years, I was president of Lions Club. We collected 4,000 glasses, the specs for people like you. Your one is gone, we are wearing contact. So we'll collect them. Then there's an optometrist who will collect and give it to people who cannot afford it. During last month, we did blankets and jackets for veterans in Hicksville area. And during July, August, we gave the backpacks and the school supplies for a small, but 4 different schools in Westbury, Corona, and all. So these are the thing at small level. We do it. We like, so like if Dr. Brother is there sitting with me, I say, give me $100. I'll put $100. So these are the small thing, but take an initiative. Like Vaniji has done this remarkable, do 2, 3 more, something about cancer, something about heart disease, something lung disease. Same time, do the community, like in our like our temple is very rich temple in first, but there are people who cannot even have food. Get them free food. We don't have to go to the canteen and get $5 dosa. Give them free. So these are the few things I think will take initiative, and hopefully, like if a small, like Vaniji and you, 5, 6 people start it. Is this an alarm for us to stop?
No, somebody's phone is ringing.
No. Thank you. I want to Ravinderji and Sharath and Hemaji, Shalini, Vani. I really want to thank you very much. And I'm still here.
So here I want to, I want to thank all the doctors. Like Dr. Badegaru mentioned, he never hesitates to render any kind of help to anybody. Yes, I have taken many cases to him, and it was always positive from little bit Dr. Badegaru or Dr. Venu Pallagaru, who is our board member, or Dr. Jinna Garu, anybody, they never hesitated to anybody to help them. And now we are going to add Dr. Sunil Mehra Garu as well.
Yes.
Yes. So
I have about
thank you.
5 to
Yes.
10 students or training from Vijayawada or Hyderabad every year for last 30 years. So I got a lot of love and affection from all of them.
Yeah, thank you to all your doctors for this amazing support to the community, without any kind of expectations. I really mean this from bottom of my heart, because Dr. Badegaru has been very helpful when my father was in the hospital, and he really took all my calls day and night. I was, I couldn't help myself calling him, though it was midnight, but he definitely answered my calls anytime. And same thing with Dr. Venu Garu, Dr. Jina Garu. So thankful to all the doctors for all that you do. So, Dr. Mehra Garu, please do expect calls from me now on.
No, I'm as a player to be part of thing, and as I said, we are one community.
Yes, thank you so much.
Vani, Sunil, hold on. Sunil Reddy wanted to ask one last question, I think.
Sure.
I can put him on this.
Hi.
Yeah, please go, Sunil Garu.
I can't say no to another Sunil.
Yeah, good afternoon, everyone.
Afternoon.
Yeah. Thank you, Dr. Mehra Garu, for valuable time to share our community such a wonderful even information, because it's not a small information, because most of them needed this information for in most nowadays, like everybody facing some other way in cancer is booming everywhere, not only age, everyone. So I have one quick question. I have a couple of questions. Is there any full body screening that could detect all kinds of cancer in human body?
No, that will pick up only when the disease is advanced. So yes, they but there are certain people are doing that. This is very good for rich people. If you have access to money, you can do that. So you can do the whole body scan. You will pick up some. This is a thing when you go for fishing, you'll catch a crab, then you are stuck. So you do a whole body scan, you'll find some spot somewhere. So what to do with now? So you will be in a fix. So I don't recommend that kind of a treatment. This kind of the blood type, I think not at of this moment, I will recommend it, but maybe in 2, 3, 4 years because false positive create more trouble, So this is like a person goes for a CAT scan for belly because he had belly pain, and then he comes, oh, they found a spot in my lung. What to do? Then we get stuck. We have to do a CAT scan every 3, 4, 5, 6 months. So this is like, be careful when you do that kind of a thing, So that will put you in more stress, tension, etc.
All right, thanks, ID.
And this is not recommended by literature to send patient. And this is a sad part. These are emergency room. You go for a pain in the toe, they will do your CAT scan the whole body to find something. Then you get in trouble. Then you get 4 consultants coming and billing you for those. No, dangerous.
Right. And also, we all hail from the India and the Indian background, and most of them came from India. Which country has the best cancer treatment? Maybe in US or India.
You are in New York, Memorial Sloan Kettering, Cornell, they're wonderful, and New York, excellent institution. There's a lot of work being done in France, Germany, a lot of it. So, but I think you're at the Mecca of medical treatment here.
What about in India? Like India, we have any best treatment, cancer treatment places?
India is great. I see the hospital now, which are like much better looking than certain hospitals here. But I'm biased. I think that the Indian doctors are very smart. They have more experience because patient load is so much. Our population is so much. Here, a doctor sees 10 cases a month. They're seeing 100. Only thing is, if you have trust and ethics, that is, I hear from friends, relative, that they make you go through certain things which are not ethical. So I think if you are in Hyderabad or you're in Bombay, Tata, you know certain doctor, go for it. They have much, much more experience in medication. They're cheaper, but you have to see the ethics. If your family or they recommend it, I'll definitely have faith in those doctors.
Thank you so much, Dr. Mehra Garu. And thank you so much, Krishna Vade Garu. And thank you, Vani Garu and entire EC team. It's a wonderful program. Thank you so much. Thank you for giving me an opportunity.
Sunil, the other Sunil was ex-president of NYTTA.
Oh, very nice.
Yeah. Hello,
Sunil is good. Sumi is good. You know that.
Right.
Thank you. But no, I enjoyed this afternoon. Thank you.
Yeah, thank you so much, Dr. Garu.
I echo Vani Gari's statement about Bade Garu, how he helps the community here in New York and elsewhere too, because I was one of the beneficiaries of his advice. And when I got COVID, hospitalized for 15 days, he used to call me every day and used to guide me and my family. Thank you, Bade Garu.
The wonderful friend of mine.
You're welcome.
Okay. So, ladies and gentlemen, on behalf of NYTTA, I extend heartfelt appreciation for our active participation in our online cancer awareness session. Our sincere gratitude goes to Dr. Sunil Mehra Garu for his expertise and guiding us through this valuable session. Thanks to all participants for making this event truly special with your positive energy. We also want to express our thanks to the advisors and board of directors for their unwavering support. Special acknowledgements to Dr. Krishna Bade Garu for introducing Dr. Mehra Garu to NYTTA. Also, a special thanks to our pillar of support, Dr. Paila Malla Reddy Garu, donors, volunteers, and community members. A heartfelt thanks to our media partners, Mana TV, Program Director Ragini, Global Media Head Sharath Garu, Program Coordinator Harish, and Technical Guru Lalesh for their continuous support. As we wrap up, let the awareness and empowerment resonate. Remember, prioritizing your well-being is crucial, and today's cancer awareness session marked a small stride in achieving that equilibrium. Thank you all for contributing to the success of this awareness initiative. I am Soumya Sri Chetari, a Joint Secretary for NYTTA Community, And right now I'm pleased to invite Vani Garu to share some insights about our upcoming events. Thank you so much.
All right. Yeah. Thank you, Soumya. Once again, thank you, Dr. Sunil Mehra Garu, for this wonderful session. NYTTA is always there. If you have any kind of projects that you want NYTTA to support to help the community, we are definitely there and we'll be more than happy to do that. So thank you, Dr. Bade Garu, once again for being there for all of us anytime. And I want to, share our upcoming event. I want to invite Dr. Mehra, his family, friends, his team to our event, which is on March 23rd, 2024. March 23rd. This is NYTTA Sambaralu. It is going to be held in the Flushing Ganesh Temple. We will be celebrating Mahashivratri and Women's Day on this day. And we have a live band who is going to perform. And there is one more surprise that I don't want to reveal it right now. So fingers crossed, we'll know eventually. So please, I invite all our viewers who are watching, our community members, our volunteers, our donors, everyone to be part of this event and enjoy this wonderful event hosted by NYTTA. Thank you all so much.
Thank you.
Thank you, Vani.
Thank you.
Thank you all.
Thank you.
Thank you, Vani. Thank you, everyone.
Thank you, everyone.
Thank you, everyone.
Thank you, everyone.
Bye.
Okay. Are we still on air? Sharad Garu, can you cut? Sharad Garu, can you confirm if we are not on live on air?
Looks like he's on mute.
Yeah, we have this air is out and
Okay.
the
Okay,
rest
we
of
can
pages are
talk.
blank.
You're sure, right? We are not air, honey?
Yes.
Okay, we can talk.
Sharad, thank you so much for taking care of all the technical difficulties.
Yeah.
Yes, thank
I
you.
was just about to leave, sitting here doing nothing. Thanks again.
Well, actually, I mean, I apologize for.
No, it happens. I was just
errors,
joking. I was just joking. It happens.
Yeah.
Not that, we faced some challenges with the internet and all that, and little ruckus happened in the beginning. But I think everything went smoothly later.
It did.
You saw me yesterday and today. I'm a dumb-headed guy at the computers.
Oh, please don't
I mean,
say
my take will be the same yesterday and today. That you're the subject matter expert, and only you handle what God created, and I'm handling what man created. So.
Well said, Sharad. True.
Okay. Thank you, everybody. I have to go.
Thank you, Dr. Bade Garu.
Thank you.
Thank you so much. Thank you all.
Thank you, Bade Garu.
Thank you, Andy.
Thank you.
Thank you. Thank you all. It was a great session.
Thank you.
Bye.
Bye.
Bye. Bye all.
Let's all get some energy for our next event.
Yeah,
Great.
wonderful. Well choreographed, Vani. Everyone,
Thank you.
team lo andaru kuda
Yeah.
చాలా షేప్ అప్ అవుతున్నారు in terms of I think you're doing some rehearsals back end lo, and Pawan, you've been there with Vani. Yeah, but wonderful.
Thanks to both of you, actually. My
active. Pawan is actively, engaged. బాగుంది. ఇప్పుడు వాళ్ళు మాట్లాడేది కానీ దెర్ అవుట్ ద స్క్రిప్ట్ ఇన్స్టెడ్ ఆఫ్ ఫంబ్లింగ్ ఆన్ ద కెమెరా ఇవన్నీ కాకుండా they know what they are talking. That adds value to the audio visual. వెనకాల స్క్రీన్ వెనకాల ఉండి అని చేయొచ్చు లేదా కానీ ఇట్స్ వెరీ గుడ్ దట్ యు ఆర్ ట్రైనింగ్.
Building leaders.
Lot of things going behind the scene.
వెరీ గుడ్,
Yeah.
వెరీ గుడ్, నైస్ సెషన్. ఆయన కూడా క్రిస్ప్ గా చెప్పారు. ఇట్స్ నాట్ గోయింగ్ టు అవర్స్, బట్ క్రిస్ప్ గా
Oh, yeah.
అయిపోయింది అది.
Very
కదా
nice. Yeah.
పవన్?
Yeah, exactly. It was so crisp and clear. Yeah.
Good.
Yeah.
Good, good.
Keep up the good work.
Good, Vani.
Thank
Nice
you.
job.
Thank you.
Okay, bye,
Thank
Sharad. Take care. Bye.
Bye, Sharath.
Bye.
Thank you.
Thank you.
Bye.
Thank
Bye,
you for
Pawan garu.
taking care.
Bye,
Yep.
Vani. Bye, Srinivas garu.
Bye, Nana. Take care.
Chalo. Yeah. Bye. Bye, Ramagaru.